We want to help support these mothers. I think we can do better in this country, making sure that we're walking alongside them in these situations and making sure that they do have the type of health care and the support financially that they need.
Well, let's look at that support. The Nonpartisan Commonwealth Fund, a social policy think tank, says the 14 states that have the most restrictive abortion laws, including South Dakota, invest the least in policies and programs for women and children. So what do you mean when you say these mothers will never be alone?
Well, I would say that the facts on the ground are that South Dakota is doing a lot to coordinate with nonprofits, with churches, and then also the state in a new way by launching this website and committing to in legislative session to support these mothers is incredibly powerful. You know, this is a conversation that we have a change now at the federal level. The states will be each evaluating how they approach this situation. Getting health care to mothers, helping them during a time of crisis is incredibly important. And these states, remember, Martha, are overwhelmed right now with other situations that are going on, with what Joe Biden is doing to the energy prices in this country, what inflation is doing in this country.
I want to stick with abortion. I want to go back to abortion, Governor.
There's a lot of things that need to be addressed in this country.
And just one more question. What if your constituents travel to another state to get an abortion?
You know, that certainly isn't addressed in our statute today, and so I think that's things that there'll be debate about, but also we're having lots of debates in South Dakota, how fundamentally our life has changed the last couple of years, just with increased costs and inflation and what this administration is doing to every single family's budget and life.
Ever notice how it's always the people yelling the loudest about how they're unilaterally responsible for protecting life, whose states always manage to have the worst health outcomes? Yeah, funny how that works out, huh? Now, first off, South Dakota Governor Kristi Noem says that because we have a change now at the federal level, the states are going to reevaluate how they operate. In other words, just because abortion was federally protected before, red states apparently didn't think it was important to invest in neonatal care and policies for mothers and children and preventing high maternal mortality rates. Why would someone's right to an abortion have any impact on a state's ability to have invested in these things they claim to care about, namely the life of a child? If you cared about life, shouldn't those states have shown that regardless of what some unrelated court decision on abortion said? It's almost like, and I hope you're sitting down for this, these states didn't care about life before, they don't care about life now, and their talking points have no association with reality. Notice too how when asked about prosecuting those who travel to other states for abortion, Noem leaves the door open to exactly that. We're talking about telling US citizens that they can't travel freely within this country for healthcare. I really try not to overuse the word fascism because I know that it cheapens its impact. But this is precisely what fascism looks like. Just like these Republicans crow about protecting life only to deliver the worst health outcomes in the country, they beat their chests about freedom, and yet here you have not only the governor of a state, but one of the most prominent emerging voices within the GOP refusing to rule out the idea of prosecuting women who want to travel within the United States for their own health care. Don't be afraid to say it. These people are actual fascists. Now, as for the Commonwealth Fund, it acknowledged an amicus brief that identified the 14 states with the strictest abortion restrictions: Alabama, Arkansas, Indiana, Kansas, Kentucky, Louisiana, Mississippi, Nebraska, North Dakota, Ohio, Oklahoma, South Carolina, South Dakota, and Texas. They also show the weakest maternal and child health outcomes and are least likely to invest in at-risk populations. Those outcomes are based on risk measures like unwanted pregnancy, low infant birth weight, infant mortality, child poverty, and adverse childhood experiences. For example, Mississippi, whose abortion ban is at the center of the Dobbs decision overturning Roe, ranked dead last for health system performance on measures like preventable mortality and children without appropriate preventative care. And yet the plaintiffs in that case had the audacity to claim that their side is fighting on behalf of life. These people aren't pro-life, they are pro-birth, and their compassion ends the moment a human is actually born. And by the way, the data bears out those consequences pretty clearly. Of the 15 states with the highest child poverty rates, 12 voted for Trump, and of the 15 states with the lowest child poverty rates, 11 voted for Biden. And it's not any better for maternal mortality rates. Of the 15 states with the highest maternal mortality rate, 12 voted for Trump. Of the 15 states with the lowest maternal mortality rate, 13 voted for Biden. Any way you cut this, it becomes clear that while Republicans parade themselves around like these great defenders of life, None of the actual facts support that claim. You can fit the Titanic between what these people say and what they actually do. And look, the fact is that on every metric, Republicans have failed to show that they care even mildly about life. They fall over themselves grandstanding about protecting these babies, and yet they vote against childcare. They vote against early education. They vote against universal pre-K. They vote against child tax credit. They vote against SNAP, where half the recipients are children. They vote against Medicaid, where again, half the recipients are children. The only thing it seems that Republicans are actually for is forcing women to give birth. And then after that forced government intervention, well, it's more of a hands-off approach. So look, these Republicans will twist themselves into pretzels explaining why a position supported by less than a third of Americans is somehow the right one. But what they don't seem to realize is that it's not their decision what a woman does with her own body. And it just goes to show that they're not actually about small government in the slightest. They are about consolidating power for themselves and imposing their own theology on everyone else. To see more videos like this, click the subscribe button right here on this screen. And to support my work beyond that, check out my podcast, No Lie with Brian Tyler Cohen, where I cover the week's most important stories and interview the biggest players in the world of politics, including President Biden, Kamala Harris, Pete Buttigieg, Elizabeth Warren, Katie Porter, and so many more. The link is also right here on this screen. And finally, to take action yourself and sign petitions on the most important issues, go to briantylercohen.com/petition.